It's my pleasure today to talk about an important topic, older age. Is it a challenge for fasting Ramadan or not? Advances in medical care and improved social conditions increased life expectancy. And the epidemic of diabetes will continue in older individuals. And according to IGF, the 19th Atlas, 1 in 5 people with diabetes is above the age of 65. And this is the IGF Atlas 2021 about the prevalence of diabetes by age and gender. We can find increase in the prevalence of diabetes with age, correlating with age, and the highest prevalence of diabetes is above the age of 60. And diabetes in old age is a risk factor for many complications and comorbidities like dementia, falls, hip fracture, cardiovascular disease, amputation, and visual impairment. And elderly people have an increased risk of volume depletion. Thus, fasting during Ramadan in this group of older people with diabetes may affect their postural balance and attention, and this may increase the risk of falls or falls-related injuries. Diabetes in geriatric times is characterized by risk of hypoglycemia, which may lead to impaired cognition. This is increased in elderly with diabetes. Other older adults may also have neuroglycopenic manifestations of hypoglycemia in the form of dizziness, weakness, delirium, confusion. When these symptoms are compared with adrenergic manifestations in the form of tremors or sweating. These symptoms may be missed or confused for a primary neurological disease, for example, transient ischemic attack, leading to inappropriate diagnosis and management. Severe hypoglycemia account for 17% of all hospitalizations for type 2 diabetes in the elderly. Age per se should not be a barrier for safe fasting during Ramadan. Comorbidities, complications, type of antidiabetic medication, and the presence of hypoglycemia or hypoglycemia unawareness will remain the main concern. The prevalence of cardiovascular disease and impaired renal function can compromise the safety of fasting in elderly with diabetes, making their glycemic control challenging. And this is the Research.org 2022 global survey about Ramadan fasting during COVID-19 pandemic and the impact of older age on fasting among adults with type 2 diabetes. And in this survey, we investigated elderly people with type 2 diabetes, and there was two groups, group with age between 65 and 75 years. They were above 2,000 persons, and another group above 75 years old, and they were 428 patients. And also these two groups were divided according to the duration of diabetes, to those having duration less than 10 years, another group having duration between 10 and 19 years, and the third group had duration more than 20 years. In older age, in this research, we found that there was better hemoglobin A1C control, and in those persons having diabetes for less than 10 years, the hemoglobin A1C range was between 7.6 and 7.9. It increased a little bit to 8.1 to 8.4 in the group with duration between 10 and 19 years. And then in the group with duration more than 20 years, the hemoglobin A1C range was 8.2 to 8.5. While those people with diabetes, older people with diabetes, as regards the body mass index, the mean body mass index, there was no obesity in the mean body mass index, and the range was between 25 to 27.9 mean BMI in the 6 different age groups. These were the medications used, and metformin was the highest medication used in both groups below 75 and above 75, followed by different types of insulin, sulfonylurea, DPP-4 inhibitors, SGLT2 inhibitors, and GLP-1 receptor agonists. And these were the diabetic complications: hypertension, hyperlipidemia, retinopathy, neuropathy, microalbuminuria, nephropathy, and CKD, macrovascular disease, and diabetic foot problems. And those were the percentage fasted Ramadan. And the percentage fasted Ramadan was highest in the group between 65 and 75 years old. And the percentage was less in the group with highest duration of diabetes and age above 75. These were the patients complaining of hypoglycemia according to the time of the day, and the duration between 3 p.m. and Maghrib was the highest in the incidence of hypoglycemia in both groups above the age of 75 and between 65 and 75 years age, followed by between 12 p.m. and 3 p.m. and between 9 a.m. and 12 p.m. These were the hospital admissions due to hypoglycemia, and they were maximum above the age of 75. And the frequency of hypoglycemia, more than 8 episodes per month, was highest also in the group of age above 75 and duration of diabetes more than 20 years. These were the incidence of hyperglycemia, and it was maximum in the group of age above 75 and the duration of diabetes more than 20. Hospital visits or admissions due to hyperglycemia again was highest in those above the age of 75, and the frequency of hyperglycemia was increased above the age of 75, related also to the duration of diabetes. Let me remind you of some results of the same DAR global survey. And people with diabetes who intend to fast was asked some questions, and this was one of the questions: did you break the fast because of diabetes-related illness? And we found that 75% of the patients in Egypt did not break the fast. 20% of the patients in Egypt did not break the fast due to any related diabetes illness, and also in Turkey, 11% only break the fast due to diabetes-related illness. Another important question: did you have to break your fast during this Ramadan because of hypo or not? And the answer was no, I did not have to break my fast in 35% of Egyptians who fasted Ramadan, and in 80% in Turkey this is really alarming that people did not have to break their fast during Ramadan because of hypoglycemia. And let me finish with some recommendations for safe fasting in the elderly. A pre-Ramadan focused diabetes education on safe fasting and when to break the fast in conditions, for example, of hypoglycemia, hyperglycemia, or dehydration. And also the pre-Ramadan education is to improve the hypoglycemic awareness. To stress on home blood glucose monitoring in different timing and on good hydration, especially in summer with longer fasting hours. DPP-4 inhibitors should be used over sulfonylureas as second-line therapy after metformin. And when using sulfonylurea, glycoside MR and glimepiride should be used instead of glipenclamide, and meglitide may be used instead of glyporide, and basal insulin analogs may be used instead of NPH. By this summary of recommendations, I finish my presentation and thank you very much and Ramadan Kareem.